We have two dietitians here with us in the studio today because we know when we start talking about exercise and diabetes, there are questions around what you should be eating pre, during, post. How can you use nutrition to really fuel your exercise? One of our guests is Barb Nakanishi. She's a registered dietitian at the Delaware Health Center. She is a certified diabetes care and education specialist. She has her bachelor's degree from Ohio University, and she completed her dietetic internship at Riverside Methodist Hospital. She lived and worked for many years in Southeast Ohio, and within the past year, she returned to Delaware, which is her hometown. She enjoys walking her dog, trying new recipes, and meeting new people. Our other guest speaker is Alyssa Bixler. Alyssa is a registered dietitian at the McConnell Heart Health Center, and she is also a certified diabetes care and education specialist. She has a master's degree from The Ohio State University in clinical nutrition. Alyssa is the quality coordinator for our McConnell diabetes program, which is an accredited program that we have at McConnell Heart Health Center. She likes spending time outside, cooking creative meals, and partnering with people to achieve their goals. So welcome to you both. We're excited to have you here and to learn more about nutrition and exercise.
Hi, I'm Barb. I'll get us started on exercise, fuel, and diabetes. Our objectives today are to help you use safety and to implement the safety suggestions we give and to use the fuel and fluids tips before, during, and after exercise. So let's start with safety. So we always say get initial permission from your physician to exercise because you may have special circumstances. Whether it's you've had surgery and or maybe you have weak blood vessels in your eyes, you may have some activity restrictions, or maybe you have a wound on your foot and you may have walking or standing restrictions. So we suggest, once you get permission, that you check your blood sugar before and after exercise for 2 weeks when you have a new exercise program or you're changing your duration, frequency, or intensity of exercise. And Alyssa will tell you what to do if your blood glucose is too high or too low, and shortly. So we definitely want you to stop exercising if you feel chest pain or chest pressure, if you have unusual shortness of breath, or an abnormal heart rhythm, or you just have intuition that something's just not quite right. Here are some general, obvious kind of suggestions or tips. And remember, some of these are based on your unique type of diabetes and your particular care plan. Let someone know when and where you're exercising. Check your feet before you exercise and wear comfortable shoes and comfortable socks. And please check your shoes, look in your shoes or reach in your shoes and make sure there are not any foreign objects. I met a person once who was swimming because he had neuropathy, nerve damage to his feet, so he was trying to do the correct exercise, but he was in a hurry when he left the pool and he put his shoe on and his watch was still in his shoe and he could not feel it. So of course, I met him when he was in the hospital having some wound care for his foot because he wore his shoe quite that whole day and didn't even know it. Anyway, I want you to wear layers if it's cold outside. I purchased a new coat this year because it's pretty cold. It's near 0 degrees outside and I have to walk that dog. So wear layers, wear the correct clothing, exercise indoors if you need to. And Alyssa always says there's no such thing as bad weather, just bad clothing. And if it's hot outside, pick a time of day when it's cooler. We do want you to enjoy your exercise. Some more tips for you: carry identification and even the emergency contact number. I know hikers are good about this, putting their information in their backpacks. Carry your cell phone, your water, your monitoring equipment and supplies. And I recommend that you keep your carbohydrate source on your person, not in your locker at the gym. I know people who became lightheaded and had low blood sugar and it was just too inconvenient to get to the locker. And we recommend, if you can, bring your snack to follow your exercise. And speaking of food, Alyssa's going to take it from here to show you some more examples of how to fuel yourself before, during, and after exercise.
Thanks, Barb. So what we eat around exercise makes a difference on how we feel during our exercise, our risk of injury, and how we recover after exercise, which sets us up for our next exercise session. So we're going to talk about what to eat at all those times around exercise. So we'll start with before exercise. Eating before exercise around 2 to 3 hours gives the time for that fuel to get to where it needs to go and give you the energy you need for that exercise session. If you're exercising early in the morning or you can't exercise or eat within that 2 to 3 hour window, you might consider eating closer to your exercise session. I would personalize that based on how well you tolerate eating before exercise and what your blood sugar is likely to do during exercise. So speaking of blood sugar, Barb talked about testing your blood sugar before exercise. If your blood sugar is under 100, we would recommend that you'd eat about a 15 grams of carb snack prior to your exercise. And I have some examples to show on my tray here. Something that's going to be focused on carbohydrates is what you want to eat going into an exercise session. That's giving your body more of a quick fuel source you'll need for exercise, but the right amount so your blood sugar goes up enough, but not too much. For a lot of people, 15 grams of carb will raise your blood sugar around 40 points. That puts you at a nice level going into the exercise session. So we have half a banana, applesauce or a fruit cup that's unsweetened, piece of fruit, throw in a kiwi for something different, some grains. Could be some easy examples to try going into an exercise session, whether you need some fuel before exercise or if your blood sugar is under 100. If your blood sugar is high, that can also be unsafe to exercise, and it makes sense to have a plan with your doctor. What would I do if my blood sugar is high? And we would say above 240 milligrams per deciliter would be an example of a high blood sugar. If you're taking insulin, you definitely want to assess for any signs of ketoacidosis if you have a high blood sugar before you exercise. So if you feel symptoms like fruity breath, nausea, really thirsty, extremely tired, would be some examples of early signs of ketoacidosis. Check for ketones before you exercise if your blood sugar is high and you have those kind of symptoms. During exercise, there's two things to think about. One is something we love about exercise is it lowers our blood sugar. There is, though, that risk of it going too low. So as Barb talked about for safety, you want to keep something with you in case you start to get symptoms of low blood sugar while you're exercising. And I have a tray for that, some examples, things that are easy to carry with you that can also raise your blood sugar quickly if it's actually going too low. So a few hard candies, glucose tabs or gel, which you could pick up at a pharmacy, or maybe a granola bar would be some easy things to carry with you while you're exercising in case you're starting to feel signs of low blood sugar. We would always recommend if you feel like you're getting a low blood sugar, it's best to test your blood sugar if possible. That's not always possible, but it does really help you if you can test and know what's going on a little better. The second reason you might eat during exercise is based on how long you're exercising. So if you're exercising longer than an hour, it makes sense to give fuel to your body during the exercise session. So maybe you're going on a long hike, or you're swimming all day, or you're golfing. Those are things that might be a long period of time where you're exercising, and it makes sense to have fuel planned during the exercise. Take it with you. Something really simple could be just a sports drink, or some of those examples I've already showed could be simple to take with you as well. And then Barb is going to talk about hydration during exercise, but we definitely want to make sure that you have your water with you and you're staying hydrated because we're sweating, we're losing fluids while we exercise as well. What we eat after exercise really sets us up for how you're going to feel that next day and how you're going to perform at your next exercise session, because our cells are really receptive to refueling within an hour of exercise. So we want to make sure we take advantage of that. It is best to eat something within 30 to 60 minutes after exercise. And after you exercise, you want a combination of both those carbohydrates and protein. So we'll talk more about that. When I think about protein, I always think about 3 categories, and it's just an easy way for me to remember what has protein. So you will probably always think about your meats and egg, also dairy products and legumes. So 3 easy sources of protein. Anything in those categories would be a nice way to get protein after you exercise. I get questions about protein supplements. They're not necessary. We can get the nutrition we need from food, but sometimes they're convenient. So it's something you could consider as an option. I have an example here of one that's nice for diabetes. That's basically like a shake that's made for people with diabetes, and it does have that balance of protein and carbs we want. So it does tend to work really well if you have diabetes to use that kind of meal replacement or a snack shake. Carbohydrates refuel our glycogen stores. So basically our cells store an easy source of energy, which is called glycogen, and when we exercise, we burn that up first. So our cells are really receptive to accepting more glycogen back in them right after we exercise, and when we refuel our glycogen stores, that's what really sets you up to have the energy for your next workout. You know, fatigue is fast when you've refueled your glycogen stores. So that's why you want that balance of carbs and protein, along with the fact we need to make sure our blood sugars stay in a healthy range. So again, wonderful that exercise lowers our blood sugar. We just want to be mindful of that so that we refuel in a way that matches what our body needs after we've exercised. So I always like to recommend picking what I'd call a quality carbohydrate, something that gives your body more bang for the bite in terms of other vitamins and minerals and fiber and nutrition that comes along with the carbs. So whole grains, maybe sweet potato or potato, fruits, yogurt and milk, peas and legumes are some nice examples of what I call quality carbohydrates. And these are some examples of possible planned snacks you'd have within that hour of exercise. I would say if you have the option to eat your meal within that hour of exercise, that's a really nice option. You can time your exercise around your eating schedule, and that helps with weight management. But if you don't, it makes sense to plan a snack or something to eat within an hour of exercise, and I have some examples of that. So this is where we want both carbohydrates and protein. If you've exercised around 30 to 60 minutes, drop my cheese stick, but then about 15 to 30 grams of carbohydrate and 10 grams of protein would be a nice example of how much nutrition balance to aim for. So some examples would be, this is like a lower carb yogurt, so combining with the berries is our right amount of carbs and protein. Or some yogurts just have the right amount by themselves, like this one. I made a delicious little pita pocket here with 2 ounces of turkey, threw in some feta and cucumbers for fun. That would be a perfect balance of nutrition you need. I have several different bars examples because if you're on the go, something like this could be really easy along with that nutrition shake I was showing you earlier. The trail mix here, this is a 1/3 cup. It only gets about 5 grams of protein, so I was going to suggest have that cheese stick I dropped with it, and then you're just on track for how much nutrition you need. Thank you. So this is a good little combo too that could be very easy to take with you on the go. So there's many examples of things you could have after you exercise, but that's kind of the general balance you're looking for, and quality nutritional foods that give your body what they need. One other product I really like, you probably have heard a lot about having chocolate milk after exercise. That tends to be like an easy thing to have. You hear athletes using that because it has a nice balance of carbohydrates and protein. When you have diabetes, I really like the ultra-filtered chocolate milk as an option. An example is the Fairlife brand. That has a little bit less carbs and a little more protein. I think that tends to work well and kind of be an easy option after exercise too. That tastes nice. Even if you didn't get a chance to eat your post-exercise meal right after you exercised, aim to still have that within 4 hours of exercise. If you've had your heart rate up for 30 minutes or more, to fuel your body and match your fuel with when your body's using it and needs it. And that meal should be balanced, like we were talking about, carbs, protein, vegetables, of course. Typically, women at a meal would recommend 30 to 45 grams of carbohydrate. If you've exercised more intensely, I would say even up to 60 grams of carbohydrate. And for men, 45 to 75. That gives you a general idea, but you definitely would want to personalize your carbohydrate goals when you have diabetes with your dietitian, your doctor. And then this meal planning plate is simple, but it's really effective if you use it to plan a balanced meal. You've got all the components of the meal you're looking for, and helps you think about your portion sizes. The 9-inch plate has been shown to be a really helpful size plate to get us the right portion sizes we need. So an easy way to think about meal planning for a healthy meal, really anytime, but definitely after exercise. So I'll turn it over to Barb to talk more about fluids.
All right, we'll circle back around here. So fluids are so important for exercise. They help keep your energy levels up. Of course, they regulate your temperature, help you concentrate, and really can help you prevent getting a cramp. So we really need to focus on being hydrated throughout the whole day. And because it takes a while for fluids to be absorbed into your body, so I want you to think about drinking slowly and often rather than trying to play catch up and drinking all the fluid you need right before you run out the door to exercise. So for example, if you aim to drink 2 cups of fluid over 2 to 4 hours before you exercise, that's beneficial. And then, of course, if you feel thirsty, make sure you drink some more as you feel thirsty. The amount of fluid or water that you need, of course, depends on how much you sweat. Well, how much you sweat depends on your body size, your fitness level, your environment, whether it's hot or humid outside, and your exercise intensity. You sweat more as you exercise harder. And let's see, for those of you who might want a visual of what my urine should look like to be well hydrated, the top looks like straw. For those of you who've seen straw, the top looks like straw. That's where you're aiming for to be well hydrated. For those of you who are detailed, here I have an interesting calculation for you. It's called the sweat rate calculation. You weigh yourself before exercise, ideally in the morning before you use the restroom. You weigh yourself after exercise, again after you use the bathroom, and you subtract the second number from the first number. And if you have lost a pound, you need to replace that 1 pound. For every pound lost, 2 cups or about 16 ounces of water. So I know I went through that pretty quickly, but the bottom line is stay hydrated, keep your water bottle with you at all times, and if you feel thirsty, you're probably already dehydrated. And that concludes our food and fuel presentation.
That was incredible, and I learned a lot through that presentation. I hope you did at home as well. So great, thank you to all of our speakers today. Great information to help you get started with an exercise program, things to consider